Paracentesis is one of the most common procedures performed by clinicians in the ED and in the inpatient environment. Unlike most procedures where POCUS is used for real-time dynamic needle guidance, POCUS is more typically used for static pre-procedure planning of needle placement for paracentesis. In this image, a curvilinear probe is used with the abdominal imaging preset and is placed in either the right or left lower quadrant of the abdomen. The imaging plane can be oriented in either the sagittal or transverse plane of the patient's body, or even somewhere between these standard planes, although by convention, the probe marker should generally be oriented in the cranial direction or towards the patient's right side. The operator would then slide the probe around the outside of the patient's abdomen and attempt to find the deepest pocket of fluid. The depth of this pocket can be augmented by rolling the patient onto their hip in the right or left lateral decubitus position, placing the target fluid pocket in the more dependent position. Once the deepest pocket of fluid is identified, the operator should freeze the image and then mark the skin in some way to indicate where this image was taken. This can be done with a skin pen or more temporarily with a fingernail or even an empty syringe. On the frozen ultrasound image, the operator then places two calipers, one measuring the minimum distance of needle insertion from the skin to the parietal peritoneum, and a second measuring the maximum safe distance of insertion from the skin to the underlying organs, which may be bowel, kidney, urinary bladder, etc. In this example, the clinician can now begin the procedure knowing to expect to insert the needle at least 2 centimeters before entering the peritoneum, and knowing that if he or she is approaching 5 centimeters, they should probably stop so as to avoid injuring the underlying organs.